In this video, we will explain series of dengue fever, in which we will describe various factors about dengue fever, including symptoms, phases, diagnosis, and prevention tips. This is introductory part of series. Also, you can get help in making assignments or for your studies from our dengue fever blog. The link below in description, click and get help. What is dengue fever? Dengue viruses are spread to people through the bite of an infected Aedes species. AE aegypti or AE albopictus, mosquito. Dengue fever is a mosquito-borne illness that occurs in tropical and subtropical areas of the world. Belongs to family Flaviviridae. Dengue is defined by a combination of greater than or equal to two clinical findings in a febrile person who traveled to or lives in a dengue endemic area. What is severe dengue? Severe dengue is defined by dengue with any of the following symptoms: severe plasma leakage leading to shock or fluid accumulation with respiratory distress, severe bleeding, or severe organ impairment, such as elevated transaminases, greater than or equal to 1,000 IU per liter, impaired consciousness, or heart impairment. Dengue begins abruptly after a typical incubation period of 5 to 7 days, and the course follows three phases: febrile, critical, and convalescent. Hope you understand about dengue. For more details, stay with us for Series 2. Don't forget to like, subscribe, and hit the bell icon.